So I believe, again, I'm just getting used to the new YouTube stuff because normally I needed to start streaming, but I don't need to do that anymore, which is good. I just need to remember that. So,
Okay.
all right, Dr. Erkan, we are live.
Perfect. Wonderful.
Good afternoon, everyone. In case you didn't see the event that I just did before this, I'm back again. Today is our Bariatric Friday. As the originator of that name, I'm getting that name with the copyrights, so hopefully. So if you are working on it, please stop doing it because we already are getting our application in. So anyway, now our bariatric event, we couldn't get together with you guys last week. There was a problem with YouTube and the interface with YouTube and our streaming portal. And today we are back on. My name is Kemal Erkan. I'm the chairman of American Surgery Center as well as United Medical ACO. And I'm here with Dr. Isaias Irgau. And Dr. Irgau.
Thank you, Kemal. Welcome everybody to Bariatric Friday. I'm very happy to be here. I am a bariatric surgeon, which means I'm an expert in weight loss surgery. And I have been performing bariatric surgery now for almost 20 years. And with my colleagues at CHRIAS, we are by far the most experienced group when it comes to bariatric surgery. We have started bariatric surgery. We have established bariatric surgery centers of excellence in our area from the get-go. And we've really taken care of thousands of extremely successful patients over the years. And it's again my pleasure to be back here on Bariatric Friday. Thank you, Kemal.
Well, thank you for joining us, Dr. Ergau. And I do want to introduce our other surgeons as well. So, well, everyone knows these two by now. Michelle, her son's graduation is today, so she wasn't able to join us. She was going to be with us, but she is part of the leadership at ASC. From our other surgeon standpoint, other than Dr. Ergau, who's been the champion of these live sessions and also helping me to kind of focus on these to make sure that we can do a better job every time we are in front of you. I do appreciate his vision and his leadership. Thank you, Dr. Ergau. And we have Dr. Gail Wynn, one of the most experienced female surgeon in the United States in bariatric. I say one of the, but maybe the most experienced. And she's been one of the, she's one of our founders in CHRIAS. And Dr. Michael Peters, who used to be the program director for one of the hospital systems, he's been with us since 2005. He is, again, the expertise is our biggest strength, and we are so lucky to have great surgeons on board. Dr. Rahul Singh, Dr. George Ibrahim, who are, I say relatively new, but they've been with us for a while now. So, and the multidisciplinary approach that we have, what they are able to do in the surgical setting with the program that we started, I think getting the new and the more senior surgeons with the newer surgeons and having that mix, giving us the best of all. And we also have a colorectal surgeon who's part of our group, and Dr. Sachin Baid, he's a board certified colorectal surgeon, and we are lucky to have him in our program. Now, our registered dietitians, Fran, Amy, Beth, they are the one, I call them the backbone of our patient process because they really do see our patients multiple times during the process, prior and after the surgery, and they are extremely helpful for our patients, and we appreciate what they do. As Dr. Ergau mentioned initially, CHRIAS, with the partnership in American Surgery Center, in a short amount of time, we were able to establish so much. And one of the biggest accomplishment that we have is the MBSA QIP accreditation. There are only 10 in the United States with this accreditation. And we also got Blue Distinction Center Plus recognition from Highmark and Aetna Institute of Quality, which is the Bariatric Center of Excellence Equivalency. And we are one of the few organizations who have these certifications in the same category. So we have done so many different sessions, and I'm sure, and I see actually that in our live sessions, in our YouTube channel, most of the videos are being watched so many times, and we are so happy to see this. Now today, what I would like to do is, Dr. Irgau, you would agree most likely with what I'm about to say, and I do want to actually just send the link for this event. So there's a couple of people are texting me for whatever reason. If they were just subscribing to the channel, they wouldn't have to do that. But let me just send it anyway. So one of our biggest strengths, other than the surgical expertise, I believe are what we have done in the American Surgery Center and the modeling, the staff modeling of the surgery center. And today I was talking to one of our new surgeons who's an ophthalmologist. And when I was explaining what is, I'm so sorry, my brother-in-law is calling and I just sent him the live link. So I don't know why my family is not watching, it's so sad. So, what I was talking to him with our new surgeon, explaining the staffing model, and most ASCs are suffering from this business model, perhaps, where they have so many per diem nurses. We changed that day one. This was back in 2015, and we wanted to make sure that our nurses are permanent, either full-time or part-time. They are permanent, so they have a schedule, they have an ownership, and this actually allowed us to achieve one of our greatest success is the patient surveys. So we are running around like 99.3% these days, and that is extremely important. So I was trying to get our nurses on for the last couple weeks, but then they were busy, and then we had technical issues, and today is that day. So I'm going to ask them to join us from directly from our surgery center. All right, so let's see if I can see them.
There they are.
So you guys are all in one screen, so great. So, but we're vaccinated, and outside of this live session, we have our mask on, right? So I know you guys are doing a great job there. So, well, first, thank you for joining us. I know you guys are, today was an exception perhaps with our schedule. So we were done early because I was trying to get one from the pre-op, one from the OR, and one from the PACU, just to give us your perspective of the patients and how is it that our patients are so happy. So, and also by having you on, we want to also share our special thanks with you and how much we appreciate what you guys do for us, for our patients, and having the trust on our nurses is extremely important. And sometimes we don't say these enough. And this would be a way of sharing our perspective and also our appreciation with all of you. So I'm going to start with Jessica, but let me actually just bring my PowerPoint so then.
No, pre-operation, okay.
So Jessica Gunkel, actually her mom was on a live session with me just 10-15 minutes ago, Donna Gunkel, and I told her the same thing. So Jessica has been with us several years now, and she is mainly in the pre-op. And we have Ashley Hudson, similar to Jessica, but she started even before at United Medical while she was at University of Delaware, a Delaware nursing program. And Ashley, it's been how many years now?
Since United Medical, almost 9 years.
And Ashley's only 17, so just think about like we've. And then we have Wendy Roll, and Wendy has been with us since the beginning of our time of the takeover at American Surgery Center, and she's in the post-op area, but she started there even before, right, Wendy?
2015. Yeah, about 5 years, a little more than 5 years now.
Yeah. So it's been now 6-7 years with you as well. So now, I always tell our partners when I get the survey results, that I send these big red envelopes for all bariatric patients mainly, but all patients are getting the survey link. But sometimes they come back and I'm like, this seems like if one of the nurses wrote this because they know everyone's name. And they're so happy.
Yeah.
And what, of course, I'm kidding. They are all real. Well, I call a couple of them. Just about.
What are you saying?
So, if you can kind of walk us through what's the key for us to make our patients happy, and what you do personally from your side to make them comfortable, because each part, like from the pre-op side. So, Jessica, we can maybe start with you. So by the time patient is with you, they are fully aware of what's happening, fully awake, right? So they know exactly what's going on. So how do you do this so well, and what's most important? What do you see with the patients that makes them more comfortable from your side?
So, especially if they're bariatric patients, sometimes when they come in, they're the only patient in the prep area. So they get our undivided attention. We all obviously wear our name tags, so we push the names on and let them know who we are. I think that what pre-op does is we kind of set them up so they already kind of know what to expect. From the time they walk in, we tell them, everything that we're going to do for them in the prep area. We tell them a little bit about surgery, who's going to come see them before they go back, and then go over the goals again that they want to meet before they leave in the recovery area. We also push the warm blankets, which is always a hit for the patient.
But, the process of the patient going through all the different clearances and getting to the final day of the surgery is a big day. And I know that even in the check-in area with our business office team, just to make them comfortable is important. And I know by the time they're in the pre-op, there's no going back. So they have to really trust you fully. And I know that you are in the pre-op, you are a big part of it. But when the patient is in the OR, it's already kind of like, actually you kind of lose the advantage of patient being awake, or maybe you use that as an advantage. So like, what's the interaction that you have with the patients at that time?
So for me, I introduce myself in the pre-op area before going to the OR, do my own little interview with them, and I always stress, make sure they don't have any questions before they're sedated while they're still, conscious and not groggy, and just make sure those things are covered before they get any medication. Jess and Ginny, the pre-op girls, do such a good job before I even get there. Usually they don't have any questions. And then when we bring them into the OR, I like to let them know everything I'm doing as far as putting a little strap on, a blanket, a blood pressure cuff, anything at all. I just like to let them know what I'm doing, because I know it can be overwhelming laying on a table, staring at the ceiling, wondering what's going to happen next. And my big thing is I always hold my patients' hands. Hopefully they like it. And I've wiped a couple tears a couple times, and I always tell them sweet dreams as they're drifting off. So
I think one of the, earlier Jessica mentioned that you guys, of course, we have other surgeries other than bariatric, but when it comes to bariatric, we do bariatric every day, at least 2-3 average, right? So, yes. And until April 2018, from the surgery center standpoint, you guys didn't do any. Now, our surgeons, of course, they were doing them in the hospital. It was a big change for all of you. And 3 years later, we do about a little over 300 cases a year, which I believe is going to increase. Now, this is all you do every day, and which makes you an expert in that area, right?
Yeah, it becomes second nature.
Yeah, that's something that we want to make sure that our patients do understand, or prospect patients also know. This is what we do mainly every day, and you guys are making it more comfortable, safe, and that's extremely important. Now, when I was learning my way in the surgery center in the 2015 timeframe, so everything was new. Now, of course, from the practice side, we have experience, but now I have Dr. Irgau, who was so patient with me and explaining everything. We were going through the process, and then I realized how important PACU area also was. So I was thinking, okay, the patient was ready, patient is done with the OR, and now they should be okay. But I think the recovery is another big factor for patients' experience, because that's also what they remember. So Wendy, you are on that side for us. So what would you like to tell us?
Well, when the patients are done the procedure, they call out to the OR, from the OR, to let us know that they're coming, to make sure that we're ready, which we're already anticipating their arrival. We have everything set up, we're prepared in that way. And then we get report from the anesthesiologist first when they first come out, and then of course the OR nurse, so it's typically Ashley or somebody else, but they go through basically everything that they want us to know, as far as like incisions, how well the patient tolerated the procedure, what the vital signs were, and of course all the medications that they received in the OR at the time, so that we know what's on board. If there was any type of issue at all, we're always prepared to handle that from the beginning.
So what's the most important part from the recovery time? Is that like the first 30 minutes, first hour for our bariatric patients?
Well, when they first come out, they're typically pretty sedated, since it's general anesthesia. So for the most part, a lot of patients take, a good 45 minutes or so, maybe an hour, to kind of sleep that off. So that first hour or so, we don't rush them to wake up. We let them, wake up on their own. And the whole time we're monitoring their vital signs, have everything going that's supposed to be going, the fluids, the PCB boots are on to prevent them from getting any type of clotting. We monitor their belly, make sure their breathing's good, their belly looks good. And of course, if they're in any pain, they'll wake up and let us know, and then we can handle it right then and there. But there's no rush to wake them up, because we want them to just feel comfortable, let them sleep off the anesthesia. And when they wake up on their own is usually when we're ready to get them up and moving out of the bed. Usually it takes about an hour and a half or so after they come out of the procedure, sometimes a little less, sometimes a little more, it just depends. And the first thing we would do is sit them up to see how they're doing. If they're a little lightheaded or they don't feel well, we're not in a rush. We can move them just to the chair, and we'll just take it slow with them from that point on.
So after the operation in the PACU, they're spending average about like 6 to 8 hours, right?
Mm-hmm. Yeah, typically.
Now, one of the really important part also, after patients awake and they are recovering, when we are about to discharge them, the patient instructions and what they have to do. If you can just tell us what the process for you is and what type of question maybe you are getting.
Okay. So typically, once they come out of the procedure and the procedure's done, I believe most of the surgeons usually call the family members to let them know the patient's done, just to give them a heads up how things went. If they haven't called them, sometimes we'll say, do you want us to call the husband or wife? We'll call them and just let them know the patient's doing well, she's out. When she wakes up, we'll give you a call and let you know how she's going. So typically, the PACU nurse is the one that's in touch with the family throughout the time in PACU. And we always welcome them to call in to check on their loved one at any time. It's not a problem, it's not a bother. But typically we'll call them at different times to say, now she's doing well, we think she's gonna be ready to go at this time. We can kind of anticipate it pretty early on, how well they're doing and if they're gonna make their goals within the 6 hour mark, and we can kind of prepare the family that way.
Excellent. So Dr. Irgau, I know you communicate with them from the surgical side, just like any of our other surgeons. Anything you would like to add? Right now, our patient satisfaction score is about 99.3%. Out of 141, there's only one negative response. So the average hospitals, they're about 65, 68, I believe, local hospitals. Anything you would like to add or ask them directly? And you are on mute.
Absolutely, Kemal. So, the reason why we have such a high satisfaction rate is no doubt in my mind due to the work of the nurses. There's no question about that. Because if you think about it, I do the operation when the patient is completely under general anesthesia. So, of course, they trust me. They know I'm very experienced. They know I will be taking very good care of them. But in reality, they are not awake when I am doing my job, when I am doing the operation, okay? But when they are awake, they are interacting mostly with the nurses because the care, minute-to-minute care at the surgery center is given by the nurses, right? And they meet the patients at two very important times of their interaction. First of all, they meet Jessica in the preoperative area, and they meet Ashley as well when they're about to go to surgery. Now, no matter how cool a person is, there is nothing more unnerving than waiting to go under anesthesia into surgery. Just we understand, we're all humans, we feel that way, right? Some people show it more than others, but everybody feels the pressure when they are in the pre-op area. So the most important thing you want to see at that time is not somebody there because it's their job. You want to see somebody there because they love what they do and they care about their job as well. And the patients sense that. They sense it, that that person is there every day, but they don't look at what they're doing as a job. They look at it as something they're passionate about. And they sense that. And that single interaction really colors their whole impression about the place. Yes, we have an outstanding center, which is professionally designed. It's very clean. It's very accommodating. But that interaction with those nurses is what really, really affects the feelings of the patients. The second time they interact with nurses when they go to the recovery area is as they are coming out of anesthesia. Now, as you come out of anesthesia, you're confused. You don't understand what's going on. And the last thing you want is, again, somebody there doing a job, right? You want somebody who cares about you. You want somebody who tells you that you are the most important thing in everything they're doing at that moment. And again, the nurses show that and the patients sense it. That's why you're getting such high satisfaction rates, Kemal. So we owe it to our nurses, really, to a large extent, why we are so successful. And as you said, these are nurses who are devoted to the ASC. They're not just coming there as per diem, as you mentioned earlier on. They are permanent nurses. They are there all the time. And although it's a job for them, they interact in a way that shows that they really are passionate about it. So I could not agree more with you when you say that the nurses are really the backbone of our surgery center. And I want to take this opportunity really to thank all the nurses. Although the Nurses Month is just passed, I want to really, really emphasize how grateful we are for all the work that you're doing for our patients.
And just for that, we actually, we have to cancel twice because of the schedule and the YouTube. So otherwise it was going to be in the Nurses Month. So that was the idea. But
Kemal, can I just add one more thing to what I said? I think that there is another important thing as well. And that is, beyond the passion and beyond the dedication of our nurses, the setup in the surgery center really is critically important because you have nurses devoted to a single patient one at a time, right? Nurses in the hospital also are fantastic, right? The nurses care very much, but very often if nurses are caring for 4, 5, 6 patients at one time, it is just physically impossible for them to devote in a single-minded fashion the care that a patient needs in that particular time. right? So when you come to a surgery center where you're really caring about one patient at a time, that also, shows in the appreciation of the patient. So the passion, the dedication of our nurses, their professionalism, but also the setup we have in the surgery center where we care only on bariatric patients on those days is very important in the ratings that we're getting.
Absolutely, absolutely. And our goal is to support our patients from different angles, from different levels, from the time that they come to our office to the time that they are ready for their surgery. Yep. And after their surgery. So we want to make sure that they have a pleasant experience and they feel like they're important, which they are. And we want to make sure they feel that. And one of the reasons that we do these sessions is to educate our patients, give them extra support, and also now bring our nurses and sharing their experiences just so that they understand that this is a teamwork, and without the team being all together, it's not going to be possible. So I really do also appreciate everything that you guys have done for us, for our patients, and we'll be doing a lot more in the near future. So anything that you guys would like to add that I didn't ask for?
One thing I will piggyback off what Dr. Irgau said, what I did, he's talking about how us nurses, we have one patient at a time, but one thing I know I always share with family or friends when I say one of the reasons I love working at American Surgery Center is because we've been the same nurses for 5+ years working together, and so have the doctors. So versus a hospital where I could work in a 20+ OR hospital with multiple doctors, I work with the same 6 doctors every week. I know what they like, what they don't like, their glove size, how many stools they need. And because it's just smaller and intimate, you just get that better relationship with each other, which absolutely at the end of the day benefits the patient.
That's very true, very true. All right, well,
I also want to just kind of piggyback on what Dr. Irgau said too. When we have bariatric patients come out of the OR, they're assigned one nurse. So that nurse only is assigned to that patient. We don't take multiple patients. That's their priority. And at times I'm sure the patient is asleep or watching their vital signs and just kind of anticipating when we think they'll be ready to get moving. We'll be in touch with the family, answering questions from the family. And we just kind of make sure that they're really prepared. And they are really prepared when they come into PACU.
That's very, very important. And again, it's not just one single item or a single thing that we do. It's just so many different things that's happening throughout that process. So that's why the emphasizing the multidisciplinary approach and supporting the patient throughout the process is the main key. Certain accomplishments that we have after our first 12 months, we got our MBSA QIP, and one of the comments that I remember from our person who did the review was, well, this is like a regular hospital operation, like in terms of the flow and everything that we have in place. And I think the model works for us, for our patients, and we just want to make sure that more patients are able to take advantage of this, and hopefully we'll do more in the near future. Well, thank you so much, guys. I know I haven't seen you for forever almost because of but we talk every day with the surgery center. However, with the protecting our patients and the staff, we were limiting interactions. So, but I'll be there hopefully in the next couple of weeks. But thank you for joining us.
Of course. Thank you.
Thank you.
Bye-bye.
Bye.
All right. So, Dr. Irgau, I think what I wanted to do with our nurses, our goal, because I don't want to go through too many PowerPoint slides, just so that they can actually share, because this is nothing, again, none of these are rehearsed events. So, and to make it more, I guess, believable is, and for me to feel comfortable to do it is that so that I don't tell them what to say. So, and this is what they have to share. So, from our nurses' point, this is what we have. So you are in good hands with American Surgery Center. with the team. So anything Dr. Guy would like to add? So that's pretty much what we have for today.
No, Kemal, this is fantastic. I know you wanted to do this to honor the nurses, and that is well deserved as well, because you wanted to show them how much we appreciate. But on the other hand, this is also a window for patients to see really who those human beings that take care of them are, right? And how the flow will go. So anybody who is preparing to have bariatric surgery at our surgery center, or anybody who's looking for a bariatric surgery, this is an important window for them to get into that they can never get by reading something or watching another video come out. So this is really a great way to enhance the educational activity that our Bariatric Friday is doing. So well done.
Well, thank you. And we'll be back next Friday. So Bariatric Friday is the way to go through this process. So if we can make this more pleasant for our patients, that will just make us very happy. And we'll see you next week. Thank you so much for joining us. Bye-bye.
Thank you. Thank you. Bye-bye.